Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I want to take a moment to recognize National Custodial Day, held on Friday, and World Teacher Day. This has been a school year like no other. I want to thank both school custodians and teachers for their hard work to limit the spread of COVID-19 and to keep schools and students safe. For today's update, I would like to review the case numbers identified over the weekend and then update you on the latest results from the ongoing Serology Study being undertaken by the provincial lab. Currently, 62 people are in hospital in Alberta, including 14 in intensive care. The recent increase we have seen continues to be driven in large part by the outbreak at the Foothills Medical Centre. We continue to closely monitor these numbers. On Friday, 97 new cases of COVID-19 were identified, while our lab conducted more than 12,600 tests. On Saturday, the lab completed almost 17,000 tests, and we identified 263 additional cases. And yesterday we identified 218 new cases, while the lab conducted nearly 16,000 tests. The large number of cases identified over the weekend in Edmonton is concerning. We have seen an escalation of cases in Edmonton, an increase in the reproductive number to 1.3 last week, and a rise in active cases to 894. We are taking this seriously and looking closely at what causes are driving this increase that we are seeing. Through conversation with local public health and the city, we are determining if additional measures should be recommended in the city to bring transmission down. One alarming trend we have seen in our review of current active cases is about 11% of cases are attending work or still going to social gatherings when symptomatic while awaiting test results. This is a significant risk and is one of the factors causing our case numbers to rise. I want to be clear, if you are sick, you need to stay home. If you are sick, you should not go to social gatherings of any kind. This includes the upcoming Thanksgiving weekend. I know that we are all tired and that staying home can create very hard choices for some. The lab has been working hard to reduce turnaround times so that results are delivered as soon as possible after swabs are taken. This is the system's side of the bargain, to give results as quickly as we can. But our side of the bargain as Albertans, to stay home when sick while waiting for results, is fundamental. We cannot prevent a second wave or limit the spread of COVID in Alberta if we do not all take these basic steps. I continue to ask employers to do whatever they can to support their staff in staying home while sick. This is an important juncture. If together we cannot control the spread, we may be forced to consider additional, more restrictive measures. Turning to schools, as of today, AHS has confirmed that 43 schools that previously had alerts have had no transmission, and students and staff are now back in class. There are active alerts or outbreaks in 149 schools, which is about 6% of all the schools in the province. Currently, these schools have 319 active cases in total. This number includes 65 schools that are on outbreaks, including 10 currently on the watch list. As always, I want to remind everyone that we define an outbreak as 2 confirmed cases in a school. Our intention is to be as cautious as possible while acting quickly to take measures to limit the spread, even after only a couple of cases. Declaring that a school has an outbreak does not mean that school is unsafe. In fact, in-school transmission has likely contributed to 1 or more cases in only 18 schools, in 15 of which this is only 1 case. I am sad to report today that there have been 8 additional deaths from COVID-19 since Friday. This is a difficult update to give. I know that grieving during a pandemic is hard for everyone who has experienced loss of any kind. My sympathies go out to all who are grieving right now. While we are all tired of this pandemic, let's not forget one of the key lessons it reinforces, that community matters and we must support each other now more than ever. I ask all Albertans to keep supporting each other during this difficult time. I would like to take a moment to speak briefly about the monthly serology study that is underway in Alberta. I know many Albertans are interested in the serology testing being done by our labs. As a reminder, serology testing is different from the swab testing that Alberta Health Services and community pharmacies offer. Serology testing detects antibodies in the blood against the virus that causes COVID-19. This can help us understand how many people were previously infected with COVID-19. It does not tell us if someone is currently sick or contagious, and we don't know if a positive serology test relates to immunity to the virus. Also, it is not yet clear how long antibodies stay in the blood after someone has the virus. Some evidence shows that antibodies may fade after just a few months. Research and evidence are still emerging on all of these points. In June, I shared the first estimates from the COVID-19 residual sera study being done by Alberta Precision Laboratories. This looked at about 9,200 anonymous samples from leftover blood work being done for other reasons in the first week of June and found antibodies in 1.01% of those. This allowed us to get an estimate of how widespread the virus might have been a few weeks before those samples were taken, because it can take several weeks for an antibody level to rise after an infection. This also helped us estimate how many Albertans had antibodies in their blood in early June. After continuing the study in July and August, we have now analyzed more than 35,000 samples in total. What we've found is that from early June to early August, the proportion of people in Alberta with antibodies did not increase. In fact, the July positivity rate was only 0.55% across the province, and the August positivity rate was 0.74%. There are several reasons why, since June, this drop could have happened. The most likely reason is just a variation in sampling. The sample size in June was smaller than in July or August and could therefore be less reliable. This is supported by the fact that July and August results from our lab are similar to the results of the Canadian Blood Services antibody study released last month. They found an unadjusted positivity rate of 0.43% in Alberta blood donors, with blood samples collected between early May and mid-June, roughly the same time frame as the first APL samples. It is also important to remember that, because the tests in the Alberta Precision Laboratory study are being done on leftover blood samples, they are not representative of the general Alberta population. They are a snapshot only of the population that has needed health care and blood tests in that time frame for some reason. Obviously, further research is needed and is underway. What this tells us, though, is that our swab testing program is almost certainly not missing large volumes of cases. It tells us that we are achieving what we set out to achieve, and the protective measures that Albertans have been using have prevented widespread transmission. We are protecting each other. We must continue to do so. We cannot rely on hopes that sufficient antibodies will slowly build up in enough of the population to limit spread of the virus after enough time has passed. We must continue to employ strategic measures to prevent widespread transmission and protect our communities. Alberta Precision Labs will continue to repeat this study so we can see changes in antibody prevalence as time progresses and adapt our approach to the pandemic accordingly. With this low antibody prevalence, it reinforces the importance of our collective work to keep our loved ones and communities safe. Particularly with the rising numbers we have seen over the past few days, I want to reiterate my strong recommendation for safe Thanksgiving events this weekend. I know that many are planning for gatherings this weekend, and I sympathize with the desire to be with the people we love most, to celebrate all that we have to be thankful for. However, this is not a normal Thanksgiving. I urge you to keep your gatherings limited only to your household and cohort members, no more. I ask that you keep your gatherings as small as possible. Eat outdoors if possible, and don't share serving spoons or dishes. As I said earlier, if you are even slightly sick, don't go to a Thanksgiving event, and don't host one at your home. The greatest tragedy would be to have Thanksgiving dinner turn into an opportunity for COVID to spread to our loved ones, potentially with severe consequences. Let's celebrate all that we are thankful for by protecting each other, not taking chances. We remain in this together, and the future is in our hands. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
Yes, thank you. The first caller is Lauren Krugel, Canadian Press.
Good afternoon. One of the steps that Quebec is taking to deal with its surge in cases is banning organized team sports. I'm wondering whether this is something that's being contemplated right now in Alberta, and under what circumstances you'd go ahead with a restriction like that.
Quebec is dealing with, as you said, quite a significant surge in cases. And at this point in time in Alberta, thankfully, again, due to the collective actions of Albertans, we are not in that same place. If we were to see significant transmission happening within sporting events, which so far has not been our experience in Alberta, and if our case counts were exceeding our ability for our health system to cope, of course, we would look at all options available to limit that transmission. But at this time, again, we're not in that situation, and we have not so far seen in Alberta data significant transmission occurring in sporting events. And I just want to take a moment to thank all those who are participating in team sports, because the adherence to the guidance, making sure people who are ill aren't playing, and the many other pieces of work that those who are coaching, parents, or those who are participating in those sports are doing is critical to continue to make sure that sporting events do remain a safe and healthy activity that can support other aspects of people's health.
Operator, can you put through the next caller, please?
Thank you. The next question is from Kevin Nimick, CTV.
Hi, Dr. Hinshaw. The federal government says 7.9 million rapid tests from Abbott Laboratories should start to arrive in Canada next week and will be made available to every province. How many rapid tests will be available in Alberta, and when should people expect them?
We are working with the federal government with that shipment of Abbott ID Now equipment. And so I don't right now have the exact number of tests that we'll be receiving, but we can get that number for you offline. We're also working very closely with Alberta Health Services to plan where we will allocate and use that equipment. Because, of course, it's not going to be enough, no matter how many of those test kits we receive. It's not going to be enough to distribute to every single Albertan. So we're going to be using those test kits in strategic locations to protect, again, the most vulnerable and to limit spread in places that are the most strategic use of those kits. Work is underway to plan exactly what that looks like, and so more details will be available as that work is completed.
Operator, could you put through the next caller, please?
Ryan Robinson, Global TV Calgary.
Hey there. I'd like to ask how many of the recent deaths are connected to patients in the cardiac unit at Foothills.
So 2 of the 8 deaths that were reported over the weekend are related to the Foothills outbreak. Unfortunately, again, every one of those 8 deaths that I talked about, including those 2, leave behind people who mourn their loss, and my sympathies go out to all of them. But again, it was 2 from the cardiac unit.
Operator, could you put through the next caller, please?
Yes, the next question is from Shane Clausey, Winning GP.
Hi there, Dr. Henshaw. Yesterday, Riverstone Public School in Grand Prairie was notified of a positive case of COVID-19 at their school. Since then, all the proper precautions have been taken. And just talking with one of the officials today at one of the local school divisions, they were saying that the student who tested positive at the school had almost been out of school for 2 weeks and just received a positive test result yesterday. Obviously, this is a long time for a test result. Do you know how long the average time it is for AHS to get back a positive test of COVID-19?
We'll have to get you those details offline because it does change depending on the zone. And as I mentioned, the lab is working very, very hard to reduce those turnaround times. So we could give you a snapshot of the current data, but just know that we are working to reduce those times. Unfortunately, in zones like the North Zone, sometimes it can take longer because of the need to include transportation time. But Alberta Health Services has increased the number and frequency of couriers that are moving back and forth to get samples as quickly as possible to the labs. And absolutely, the almost 14-day delay that you're talking about is not timely enough to be able to do the work that we need to do to prevent onward spread. And so we can get those numbers to you in terms of the current snapshot, but we are, of course, working with AHS to reduce those turnaround times as much as possible.
Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. The last time I asked you about modeling, you said models show what could happen, and Albertans know that if we back away from measures, the spread will increase, and if we follow measures, the spread can be kept relatively constant. However, BC is presenting updated modeling today. Ontario released updated modeling 5 days ago. There are arguments to be made that updated modeling is in the public interest. So how come Albertans are not being given all the information they could be about what provincial officials are projecting this fall?
It's interesting, of course, to look at the other models that provinces have done. There's also been some national modeling that has been done and is, I believe, publicly available. In Alberta, again, what we experienced in the spring is that modeling as a future forecast isn't particularly helpful when it's anchored to particular dates. And what modeling can help us do more effectively is to help us look at different scenarios. And the modeling that we're undertaking is more about those kinds of planning scenarios, and it's not yet complete. And so those discussions to complete the models to make sure that we have the time to have the discussions with our decision makers haven't yet happened. And so Albertans, of course, I know are interested in modeling, but the modeling, again, won't change the foundational reality, which is that what we see over the next few months will be a product of our collective actions, and that, you know, whether or not we collectively keep the public health measures in place and follow them regularly, that will determine what we see. And no model, unfortunately, can predict the future with any certainty. But as I say, our modeling is not yet complete, and so that continues to be what we're working on, is completing that and making sure that our decision makers have that information.
Operator, could you put through the next caller, please?
Anna Yunker, Edmonton Journal.
Hi, Dr. Hinshaw. You said that you are determining whether additional measures need to be recommended to curb the spread in Edmonton. What measures are you looking at? Can you say?
We're having those discussions with the city and with local public health officials right now, so we haven't landed on any particular measures. What we need to do is look at the data, particularly, again, with this increase over the weekend, with this sudden surge in cases. I do want to emphasize a point that I've made before, which is that the new cases that we're seeing right now are a reflection of transmission events that happened 1 to 2 weeks ago. So we should expect, no matter what changes we may or may not choose to make in the coming days to weeks, we will see increased transmission over the next 1 to 2 weeks, which is a product, again, of past events. So we will see, we will likely see high numbers of cases over the next 1 to 2 weeks, which is a product of past transmission. And so we're looking at those transmission patterns to help us understand what would be most effective, and if there are other changes that we need to make to our framework to prevent Edmonton from continuing to have increasing numbers of new cases.
Operator, could you put through the next caller, please?
Cian Bexley, Rebel News.
Hi, Dr. Hinshaw. I'm wondering if you could tell me what the rate, what the number of suicides in the province is right now, especially as it compares to last year, and if there's a number of suicides or deaths as a result of coronavirus measures that would be unacceptable, you would see would be an unreasonable way to enact policy, given sort of the death count.
Let me say that any death, whether it's from suicide, COVID, or any other cause, is a tragedy, and my sympathies go out to anyone who's lost a loved one to suicide in the last several months. We have been working very closely with the Office of the Chief Medical Examiner to understand trends in suicide numbers. Of course, it does take time for investigations to be completed, and so the numbers that we see in terms of the total suicides that are tracked by that office can take some time to have accurate information. What we have seen in the data that's been provided to us so far, again, this is all preliminary, is that we have not seen higher numbers than a 5-year average over the past several months. Certainly throughout the spring and summer, we were not seeing significant increases. In fact, it wasn't early on even reaching that 5-year average. Now, as I say, these are preliminary and not final numbers. And every death is a tragedy. But as I've said before, what we need to focus on is balancing the harms, limiting the harms from COVID, as well as limiting the harms from all of our public health measures to prevent COVID. We cannot prioritize one over the other. We need to do both. And every life lost is a life that we mourn and grieve, and we want to do everything we can, again, in public health, to prevent all loss of life to every cause, and that's exactly what we're doing by seeking this balanced road.
Operator, could you put through the next caller, please?
There are no further questions in the queue at this time.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon. Have a good day.